Hello, thank you for joining us today. My name's Adam Smith. I think we're just going to give it a few minutes for people to start to arrive. Um, so hello to those that are here already. Anna, I can see you're here. Gina Turner, Lucy Morell, Captain Thomas. Thank you very much all for joining us. Numbers are creeping up now. While we're waiting, I'm just going to give a plug for some of our other activities that are going on. Dementia Action Week runs from in May, and on Friday, the 21st of May, we're going to be doing a webinar from 1:30 in the afternoon to 3 p.m. with a number of people who are going to present their work, their research on how they're helping improve dementia care in acute hospitals. This will be led by Dr. Emily Oliver, who is a research nurse at Portsmouth Hospitals, and we have a number of great presenters which we're still working out for that one. So if you'd like to, you can visit our website dementiaresearcher.nihr.ac.uk/webinars to register for that session on the 21st of May. Okay, I'm not going to wait any longer. We'll get going rather than keeping my speakers waiting. So hello, I'm Adam Smith. Welcome to the Dementia Researcher podcast. I'm the program director at University College London, and I'm delighted to welcome Dr. Zoe Clough and Dr. Leo Chouliaras, who are both clinical academics and who will both play an important role within the NHS. And today we're going to highlight the different ways that frontline NHS staff can become involved in dementia research. But before we start, I'm just going to set the scene slightly. In the 3 years to March 2020, the NHS and NIHR supported recruitment to over 869 dementia studies, and those studies involved 117,000 people across the country. With almost every NHS trust and GP surgeries being involved, this covers everything from studies looking at dementia prevention, diagnosis, new treatments and drug trials to social care. And with so many people's lives being touched by dementia, we're also seeing large numbers of clinical staff and doctors and nurses and OTs and speech and language therapists, all going back to school and pursuing careers in dementia research, which is truly fantastic. And one of the aims of Dementia Researcher is to inspire the next generation and people to consider dementia research as a career option. So we're very much looking forward to hearing from Zoe and Leo today with some advice on how this can work. The talk will be around 20 minutes. And then we'll have time for Q&A at the end. If you're watching via Zoom, you can post your questions using the Q&A box. And if you're watching on YouTube, you can post that in the chat. We are recording the session today. It will be available in YouTube afterwards. So if for some reason you have to leave early or you drop out, don't worry, you can catch up later. So thank you very much for joining us, everyone. And I'm going to shut up now and hand over to our presenters today, Dr. Zoe Clough and Dr. Leo Chouliaras. Hello, thank you. Hi, everybody. Hello.
Hi, Adam. Thank you very much. I'm just going to try and share my screen now. So
and I'll go to my camera and microphone off.
Okay. I hope that's working. Thank you very much, Adam, for the introduction and for inviting us to take part in this webinar today. And thank you to everyone for attending. Leo and I are both trainees in old age psychiatry. I work down in Wessex and Leo's working up in Cambridge. And we are the early career researcher representatives to the NIHR Dementia's National Specialties Group. And it's in that role that we're here talking to you today. We've been doing that role for about 18 months, and one of our sort of aims in doing it was to try to do a few things to raise the profile of clinical research in dementia, and particularly encouraging clinical colleagues to become research active in the dementia field. It's something we both enjoy and think is really important. So what we wanted to do with you today is to just briefly talk about why we work in dementia research and why we think it's important and why you might enjoy doing it too. We're going to tell you briefly about our own experiences and our own career paths and how we've come into research, just as a couple of examples, but there are many, many different ways of doing that. So Ours are just two examples. And then we're going to give you some ideas of ways that you might be able to think about making the early approaches in starting to work in dementia research yourself. We have put together some slides. Some of them are using a little bit of input from Professor John O'Brien. I'm not sure if he's in the audience, but thanks for that, Professor O'Brien. He is the lead of our National Specialties Group and a professor in old age psychiatry at Cambridge as well. Sorry to skip forward there. So before we tell you how you can get involved in dementia research, these are just some of the reasons why we think it's important that you might want to do it. So firstly, and I think probably most importantly for me at least, is about the sense of hope that it might give you and your patients if they choose to take part in a research study as well. I think for those of us working with patients with dementia and their carers, we probably can all relate to the experience of sitting with a patient and really wishing that there was more that we could offer them. And our options in the clinic are quite limited as things stand. So taking part in research really can help to give you a sense of hope that in the future we'll have more that we can offer our patients. And also for those people that take part, they often feel it's a really beneficial thing for them to feel they can contribute to dementia care in the future. There's lots of reasons for your clinical services why it's a good idea for them, for you and them to be part of research. So there's lots of evidence to suggest that research active services tend to offer higher quality care and have better outcomes. And it is one of the accreditation metrics for the MSNAP accreditation. I think working in dementia research clinically does enhance your diagnostic skills. We have to be quite careful about that when we're recruiting patients into clinical trials and studies. So it really helps you to pin that down, and that can benefit your clinical skills. It can improve your knowledge of new therapies or methods that might soon come to the clinic. So you might be a bit of ahead of the game in thinking about those new things as and when they come through. I think for me, taking part in research has really helped me to understand the scientific basis of dementia, particularly when you get involved in drug trials and thinking about the mechanism of action of some of the drugs that are being trialled for dementia. So it can help in that respect, and it does provide the intellectual stimulation related to that in all sorts of ways. There are additional career prospects that working in research can give you, whatever your discipline. And it gives you great opportunities to network with colleagues and go to conferences, meet people from all around the country and all around the world. You have that shared sense of purpose with you. And it does make a difference to your patients. Lastly, we both find it quite fun. So we think it's an enjoyable way to spend our time at work as well. I think Leo's just going to talk about the next slide, which is just trying to piece together how all the different aspects of dementia research happen in this country.
Hello, everyone. Thanks for coming as well. We just wanted to put this picture as well, just to give you an idea of really that there's a lot going on when it comes to dementia research in the UK. There are the two main charities, obviously, the Alzheimer Research UK and the Alzheimer Association, that support a lot of studies. There is a lot of public funding, obviously the NIHR looking at clinical studies, and then there is the MRC looking at sort of different types of studies, and all sorts of institutes, and the Dementia Platform UK, the UK Dementia Research Institute, and all of those people really are trying to work together with NHS to do more dementia research and to understand how we can really treat this disease, which is becoming one of the leading causes of death. So that's we wanted to put this picture here to give you an idea that a lot really is going on, and we do need people to get involved, especially when it comes to delivering the trials and getting to do more clinical research stuff. And I presume a lot of you are quite experienced in that aspect.
Okay, thank you, Leo. So we're just going to share a little bit about our own experiences. As I've said, we're both doctors, and I know that not everyone in the audience will be a doctor. And I think it's important to say at this point that there are opportunities in dementia research for all sorts of healthcare professionals. And I hope that a lot of the tips and guidance we'll give later on will be relevant to all different disciplines. But just briefly about our our stories and backgrounds and inspiration for taking part. So I wanted to share this picture with you. This is my grandmother and my grandfather. My grandmother suffered from vascular dementia, and it was around the time that I was a medical student that she was really starting to struggle from a cognitive perspective. So for me, that was the first experience I had at sort of seeing dementia at very close quarters, and not only seeing the impact on my grandmother, but seeing the impact particularly on my grandfather in terms of trying to care for her. And it was them that really inspired me to want to work in this field and to want to try to contribute, even in a very small way, to improving things for people with dementia in the future. As we know, it's an incredibly common condition, and probably most of us will know somebody personally who's suffering from dementia or caring for somebody. So this perhaps is something that we can all relate to with a personal story one way or another. So I did my medical school in Southampton, and at Southampton we had the opportunity to do a research project as part of our medical school degree. I did that as a sort of joint intercalated BSc and fourth year project, and I did a project looking at patients with dementia with Lewy bodies and sickness behaviour symptoms in those patients, and that was supervised by Professor Clive Holmes at the University of Southampton. I really enjoyed it, and I particularly enjoyed the patient contact and having the time to really spend a lot of time with those patients, and just was inspired, I think, mostly by the research participants and their willingness to give their time and energy to taking part in these studies. So I then graduated and went into foundation programs, and I wondered about whether I wanted to be a GP or whether I wanted to possibly be a geriatrician or to work in psychiatry. And I did some taster sessions in psychiatry and thought, yeah, I think that's where I want to be. So I went up and worked in Leeds on an older person's mental health ward in a trust grade position while I thought about what I wanted to do with my life. And then I went travelling around South America for a bit before coming back to start psychiatry training in Wessex. And at that point, I was not an academic trainee, but I thought I'm going to get back in touch with Professor Holmes and see if there's any opportunities arising locally. And so I guess I was lucky that I had those links already from medical school, and not everyone will have those, but I think it's a good tip to try and exploit any of the links you might have. So I was met with a great amount of enthusiasm from those inquiries, and Professor Holmes encouraged me to apply for an academic clinical fellowship post, which I did. And so during my core psychiatry training, that gave me the opportunity to spend 9 months of time doing a project looking at mild cognitive impairment and peripheral mononuclear cells. So it was a mixture of some patient contact and some lab-based things like flow cytometry, which was a whole new world to me. I've then gone into higher training, and I've been using my special interest sessions in that to do more clinical research-based things. So I've been working as a sub-investigator on several clinical research trials at the Memory Assessment and Research Centre in Southampton, and I've been encouraged and supported to take on my first principal investigator role during that. And it was through that I had the opportunity then to apply to take part as an ECR rep on the Dementia's National Specialty Group. So that's about where I've got to, and I'll hand over to Leo now to tell us about his journey.
So yeah, I wanted to tell you a bit of my story as well. I followed a different path to Zoe. I'm Greek originally, so I studied medicine there as well. And then when I sort of was out of medical school, I knew I was interested in the brain and how it works and the neurosciences. And I saw that as an opportunity. So I moved to the Netherlands and worked in the lab there and did my PhD in neurosciences and basic neurosciences, while I figured out I want to be a psychiatrist and work as an old age psychiatrist that I'm doing now. And my sort of field of research has been on the role of epigenetic mechanisms. So how environmental factors interact with genetics and the sort of biological mechanism behind that, and how that might be relevant for dementia and may help us to understand a bit more about it and perhaps find new treatments. And then I moved to the UK. The sort of prospect of a clinical academic career is very well structured in the UK, and I think there are lots of opportunities through the NIHR post. So I did my foundation year training in the West Midlands, which I quite enjoyed living in the area there. And then I moved on and if we could go to the next slide, then I moved on. I traveled around as well. So I went down the clinical academic path, which obviously for doctors, there is a designated one, but there is also for other healthcare professionals through the NIHR. I did an academic clinical fellowship, and now I'm coming to the end of my clinical lectureship, as they called it. One of the I did lots of good research and then moved more towards clinical studies, trying to use blood samples of people to get some biomarkers or try to link those with brain imaging findings. And one of the things I've sort of got along in the various places I worked was that I quite enjoyed doing some research along the clinical work. It's a very nice break from clinical work and keeps you stimulated and wanting to learn things and obviously understand a little bit more about the patients that we treat. But also along the way, I've met lots of wonderful people and learned a lot from them and worked in different settings. And I just put the pictures here from my former colleagues on the top in Oxford and my current colleagues here in Cambridge. And obviously we all work toward the same target. We want to improve the outcome for our patients. We want to do more about dementia, and doing research is one of the ways we can go about that. So I think I'll hand over to Zoe back now to start a little bit about how we can be involved in research and continue from there.
Okay, thank you, Leo. Yeah, so we're going to try and just give you a few suggestions now of how you might want to be getting started if you want to be involved in dementia research. And I think we've aimed this at thinking that the audience might have people who are interested at this point, but perhaps haven't started yet in their journey into dementia research. So the first way that as clinicians, I think it's really important that we're all involved in dementia research is by acting sort of as ambassadors for research in this field, and by making it part of our daily clinical practice to encourage our patients to take part in research activities. So there's a few different ways you can do that. If you've got a local dementia research centre, then it's worth getting in touch with them, and they will, I'm sure, gladly tell you how to send them some referrals. And you can also encourage your patients to sign up to Join Dementia Research, which is a national database of people who have dementia and are willing to potentially take part in some research activities. So that opens them up to possibilities throughout the country, really. And I think sort of embedding the idea that everyone with dementia should have the opportunity to take part in research, should they choose to, is a really important ethos, and that's something that we can all do and we can all start doing straight away. Other places to start, if you haven't done it already, doing the good clinical practice training is a really good place to start. It's an essential requirement for anyone working in research within this country, and you can do it for free and you can do it online. If you just go to the NIHR Learn website, you do need to register, but then you'll be able to access the learning package there. There are sometimes some face-to-face courses as well locally. I'm not sure if they're running at the moment with COVID, but there is certainly an online package you can do in the meantime. And that might just get you thinking about the way that we might think slightly differently about things from a research perspective. I think going to conferences and events is a really helpful way to start thinking, am I interested in research? Now, a lot of them are virtual at the moment, so you might not quite get the networking opportunities that you normally would, but hopefully it won't be long before we're back to face-to-face conferences. And I think if you haven't been to a big dementia conference before, it's well worth going to. There's such a variety of research going on in dementia, so it will help you to see which bits you're most interested in. You know, it might be something that's psychologically based, that's more physiotherapy based or something like that. Could be something that's quite biomedical or lab based. And at some of the big conferences, you'll see presentations on a full range of all of that. My little disclaimer is there, don't worry if you don't understand it all. I'm sure we've all been to certain conferences and just felt that some of the presentations might go slightly over our heads. I've certainly experienced that with perhaps more of the basic science type presentations. But rather than getting bogged down and worrying about that, just use it as a kind of springboard to thinking about what you are most interested in and what you might want to explore further. The next point says, don't worry if you don't have a big new idea. Few people ever do. That was, I think, one of Professor O'Brien's comments when we were putting this together. I think a lot of people feel a bit intimidated by research and think that they must have some world-changing idea themselves before they could even consider starting. And actually, that's great if you do, but it's not essential, particularly when you're starting out in looking into dementia research. So don't feel put off if you don't know or have your own idea of how we might cure Alzheimer's disease. Doing audits, case reports, maybe having the opportunity to take part in writing a review article, they're really good ways to get a feel for research and whether you feel that you quite enjoy it or not. So if you've got opportunities to do those things, then that can be really helpful. And our next sort of top tip really is about trying to find out what is happening in your local area in terms of dementia research and to try and get involved with things locally. Joining an existing study or trial is a really good way of gaining experience in working in this field. So you might want to go initially as just to observe, or you might start to want to see if you can work as a sub-investigator on a trial. So that could be a clinical trial, or it could be a study that's not about medication or anything like that. There's a wide range of things happening. If you don't know where to start, then these are some suggestions. So if you're a doctor or another healthcare professional in training, then you might be able to ask your clinical or educational supervisor for some pointers as to what's going on locally. If you're not in that position, then contacting your local university academic department would be a good place to start, and you'll find that people will signpost you where you need to be, even if they're not quite the right person. Most NHS trusts have an R&D office. They would be a good port of call again for pointing you in the right direction. And then the NIHR website has lots of links and details that could be useful. And we particularly wanted to point out the local clinical research network that is part of the NIHR. That is a network of, as it sounds like, of clinical research centres throughout the UK. And each one will have a lead person who is looking after the dementia portfolio studies. Now, we've written an article which is on the Dementia Researcher website, and I've put the link there. And if you go to that article, then you will find a link to the email addresses of all the local CRN leads for dementia. So if you don't know where else to start, I would suggest maybe trying to look at that list and contacting the person in your local area. And I'm sure you'll be welcomed with open arms and encouraged and suggested where you might want to get started. I think I'm going to hand over to Leo now to continue.
Yes, and as Zoe said, essentially your local clinical research network, or sometimes as they call it, the LCRN, is the point to start locally, to start to get involved in clinical research studies. And obviously all of the local clinical research networks, there is one in each area around the UK, and there is also the equivalent in the devolved nations. Then they all form the NIHR Clinical Research Network, which is essentially the national delivery arm of the clinical research in the NHS, and it's closely linked with the NIHR, but is obviously also incorporates social care and non-NHS settings. So it's essentially the umbrella sort of network to coordinate clinical research in the UK for all sorts of health professionals. And obviously it operates on a structure with a central coordinating center, and there are 15 regional networks. So depending on where you are and where you work, there will be a regional network. Sometimes the own networks have their own websites or their own information. So if you just Google, for example, East of England Clinical Research Network, NIHR, you will get to the website and you find all of the sorts of important information about what's going on locally and how to get part of that, how to get involved. And there are obviously disease specific, and for dementia, we have what they used to call the Dendron Network, or now it's called the Dementia's National Specialty Group, which sort of coordinates the studies at a national level. So we go to the next slide, please. I mean, one of the steps, obviously, I think the first step for people, depending on your circumstances, would be obviously to get involved as a sub-investigator in studies. And there is sometimes funding available as well to fund some of your clinical time so that you can do research in its area. They have their own schemes. I know, for example, in the east of England, we have the Green Suit scheme, the NIHR Green Suit scheme, that supports people to have some of their clinical time funded so that they can do research. And there are different depending on the profession, different ways of doing that. There are also other ways of getting more formal research trainings to a protected time for research. For example, for doctors in training, throughout their clinical training, they can follow academic foundation programs, clinical fellowships, take time out for research to do a PhD or a postgraduate degree, an MSc, and then obviously there are clinical lectureships towards the end of the training. And the NIHR has programs, especially the doctoral training program for a PhD and sort of the clinical academic program that are open to all healthcare professionals. And there is obviously one for doctors, but there is also for others, and they work on an application basis. And obviously for dementia, it is important to continue and having applications and to do more work. If we go to the next one, please. And obviously for people who are a bit further ahead throughout the research, then NIHR in its area also has what we call the research design service or the study support service. It's essentially a group of people closely working with NIHR when people don't know how to start setting up a study or getting a lot of advice for their applications when they apply for funding to get studies done or for fellowships. They can help you build up your application, help you with the design of your study, and essentially tailor it to increase the chances of this being successful. And if we go to the next one, and obviously, I think it's important to try and find out more. Each person have their own circumstances. Some people want to do that on a sort of continue having their own job and sort of do that as a side project or in their free time. Some people want to take time off and become academics. There are all sorts of opportunities and all sorts of posts people can do. If you go to the Dementia Researcher website, and Adam obviously is hosting that, you'll find lots of information there, openings, project, interviews, webinars. You will need to register, I think, with the website, but it's free. We've also recorded a podcast previously about how to get involved in dementia research and written a blog about it. But there are also some other resources. For example, the Royal College of Psychiatry has a designated webpage about how to get involved in psychiatry research in general, and the NIHR website as well. So if we go to the next slide, please. And just to give you an idea, these are the sort of how the websites look. If you just Google Royal College of Psychiatry, getting involved in psychiatry research, you'll find everything. And just to close some top tips that we sort of developed and we're looking onto what can be helpful for people. As Zoe said earlier, do get involved and try research. Even if you don't like it, at least you know that this is not the thing for you, and it will help your career choices as you progress down the line. And obviously always go with what we call in psychiatry, the gut feelings. If you feel you like academia and research, it is probably for you. So try it, give it a go, and take every opportunity that you will learn, because you learn and then you know what you're suited to. And obviously it's never too early or too late to build your CV with audits and posters and presentations, writing papers or case reports. They're all valuable for your career and applications, because those things do count. But I think most important of all, and we highlighted, is to find a mentor, someone who will guide you and support you, and who is more experienced and will obviously open all of the doors for you. There are plenty of people around, and they are all it's part of their role to support less experienced people, either in your local university department or the local clinical research network. There are always senior doctors, senior nurses, and academics who are looking for people to help them with their studies and then mentor and support you throughout your journey. And obviously, there are lots of negative things you might hear, lots of hardworking funding applications being rejected, but there are always academic opportunities, and dementia is becoming a national emergency. Lots of people die with dementia. It's one of the leading causes of death. So the government is having designated funding schemes and support programs to progress and find some sort of cure or improve patient outcomes, which is all what we are after. So that's all the things we wanted to say, and thank you very much for attending. The website will be, the webinar is recorded and will be available on YouTube to watch it on your free time or share it with your colleagues. And obviously, we also run a survey as part of the national specialty groups on how to help people get involved in research. And I think we will put the link in the chat. Feel free to fill it in and obviously look at the other resources and material, because that will be helpful for us to know what can we do to improve people's ability to get involved in research and all together working towards the biggest aim. So thanks again. And I think we have some time for questions and any discussion that might.
Thank you, Leo and Zoe. That was fascinating. Thank you ever so much. I guess I'm going to pick up on the first point, which I think is it's important to distinguish, because I think there are a number of frontline NHS staff whose first experience of being involved in research might be supporting a PI who's already a principal investigator, who's already in the hospital where they work. And I think so there are opportunities in that space, aren't there? Because of course, significant number of studies happen in the NHS, and then that's where they find people to participate in those, and those that will involve assessments in choosing the right participants, but then delivering the interventions and things. And so that's one space. And how would you suggest they go? Is that where the Clinical Research Network leads will help you find out who's doing the research in your hospital or in your area?
Yeah, so it's one of those things that probably is done slightly differently in different places around the country. So generally, I think if you contact your LCRN dementia lead, they will know what's going on in your area, and they might then be able to signpost you. It might be that one of the trusts in the area is particularly involved in delivering the dementia research studies, and they can put you in touch with the person who is most applicable there. If it's if there's a department within your own trust, then you can contact them directly, and that would be a good thing to do.
Of course, and that's for mental health trusts. Of course, quite often will be the community mental health teams or the dedicated memory clinics if you're in a mental health trust. And if you're in an acute trust, most of the time that would probably happen in neurology, right? I mean, that's and
or geriatrics is the other department that might be worth investigating about.
So that's a great first way in to becoming involved. Obviously, if you're whether you're a nurse or a speech and language therapist or a physio or an OT or a doctor, finding out what studies are going on in your area and making that approach, I think, is a great first opportunity. And then, of course, there are chances to become a researcher yourself and do your own work. I'm conscious that if you're anything other than a doctor, a first step into that might be through doing an MSc part-time alongside your studies. And there are a number of dedicated dementia MSc programs. And in fact, actually, on the Dementia Researcher website, if you go to the top and then find in higher education courses, you'll find a full UK-wide directory of all the higher education courses that clinical staff and the public as well can do, both as continual professional development or as a full-on master's program over a number of years alongside. And a master's is a great way as a first step towards research and potentially then going on to further research. And of course, I have to point towards the NIHR Academy, whose clinical doctorate program has just opened this last couple of weeks ago. And that's for anybody who's watched our webinars before or engages with our website. Dr. Emily Oliver and Dr. Anna Volkmer are just two people, a nurse and a speech and language therapist, that have been through that clinical doctorate program, and yourselves as well, of course, as doctors. What was it like? I'm just interested. Tell me what changes from you being a jobbing registrar or SHFY when you take up that clinical position with the clinical research role from the NIHR. What suddenly changes? How does your day change?
Do you want to answer that, Leo, or shall I?
I can answer it. So essentially it gives you protected time to do research, protected time off the wards. So for example, I spend half of my week doing clinical work and half of my week doing research. So essentially it gives you the time to be able to build up on your experience. But it also helps you to sort of, when people know that you have the designated time, it opens up a lot of opportunities.
And when you take that on, then do you choose your own project? Do you have to identify your supervisor in advance? Is it?
So there is lots of flexibilities, but essentially, obviously, when you're at the start, it's good to choose a supervisor and then obviously work out on a project on what is available locally, what studies are going on, or if you want to start a new study, how feasible that is and how you can do that, and obviously tailor that around your interests as well. But
so there's a great steps there, and a lot of the work that you deliver. I know we have a question on YouTube from Ashish Rastali, who asks about getting involved in clinical pharmaceutical company clinical trials. And I mean, a lot of commercial work, well, most commercial drug trials in dementia will happen in the NHS, right?
Yeah.
And so how do they function? Would people be involved in those normally, do you think?
So, I mean, I don't have any experience of working directly with a pharmaceutical company, but you're right in saying that most clinical trials of drugs for dementia, the studies are in this country conducted usually in the NHS sites. So if you're interested in working on one of those, then it would be contacting your local dementia research department and seeing what studies are currently running. That's something that I've done recently, and it's been really enlightening actually in an experience of really understanding the research process and how a drug is developed and assessed and trialed properly. And you would essentially, I suppose, initially work as a sub-investigator on one of those trials in your local department, and then that data that you get from your participants locally is fed back to the drug company, who then coordinate and pull all the results together, and they're often a multi-centre within the UK and internationally.
I mean, it is a bit tricky. I mean, we won't try to make out that this is easy breezy to get involved in that. I think it does take a little while, doesn't it, to start off and build your reputation as somebody who reliably can recruit to these studies on time to target, deliver the intervention effectively, and report back and things like that. But I think once, if you find that there is somebody in your trust that is delivering commercial trials, approaching them, because I know there's a real keenness to kind of to spread that out so that the same trials don't happen with the same 20 main investigators, which, I mean, we are talking about a pool of people that really is that small. Probably 20 to 30 at the most, what senior clinical people who deliver commercial trials in the UK. So broadening that out would be really great. And a lot of those people are, I hate to say it, they are getting older as well. There's a lot of opportunity to come through, because they can't carry on delivering these trials forever. And we are seeing more drug trials come through as well. And I think that's, I mean, and those trials do use everybody, don't they? So they'll have research assistants and psychologists and raters and nurses who will, physiologists, they involve all kinds of people involved in their delivery. So there's, very practically, you can go get involved in the trials that are already going on as a first step to perhaps pursuing your own.
Yeah, and I think I think it's a very good way of getting started, because it gives you a taste of real life important research and its practical experience of doing it. But you don't need to have a PhD to go and do that. It would be doing some training based on that specific study, and you would, as a sub-investigator, be supported by the principal investigator in your locality. So it's a really good way of getting some real life experience. It's not doing your own study, but it's a good way of learning about research methodology and how things work, and seeing whether you like it or not. So I think that's quite a good place to start.
And I completely agree. And a lot of the research assistants I've seen working on these trials, I think we've also had presentations from Sarah Gregory in the past, who I know worked on a trial and is now well into doing a PhD herself, and will also go on. And because I think you become fascinated by the work and the opportunity it presents. I'm going to have a quick look through the questions that we have. Is this going to be recorded? Yes, it is, Francis. This will be recorded and straight away available in YouTube afterwards as well, and through the Dementia Researcher website. Angela Crocker asks that they're hoping she's hoping to do an MSc impact on aging and dementia in dysphagia in adults with Down syndrome. No research ethics available, so trying to think about changing the service evaluation. Is there any advice into doing this? Angela, we I don't know if I mind answering this. We've got a great new contributor to the website called Charlie. The name will come back to me. If you go to Dementia Researcher website, she's a senior speech and language therapist from Surrey who's going back to do education at quite later in life, and is working through that process. And I think we're hoping to get more of her story over the coming year. And what motivated her was this passion to try and transform the clinical service that she was in, and seeing how people with dementia weren't necessarily getting the best care, and the opportunity to learn and to spread that through becoming an academic herself. So do have a look at that. I'll remember her surname while we move on.
And I think what Angela is asking about ethics and how to make decisions. I mean, if you can't do the work as a service evaluation project, if you need to collect new data, it will have to be a research project. But it's not impossible to get ethics. You'll need to go through the paperwork, and the local research design service and the clinical research network might be able to help with the study as well. And if it obviously becomes a portfolio study and all of that, it can be easier. So there are lots of opportunities to carry out studies.
And this is a great time as well, because the NIHR's just opened up its specific, it's not a themed call, it's a highlight notice, which means that all of the NIHR's funding streams are specifically highlighting and making requests for people to make dementia research submissions to those, which includes the RFPB, which is the Research for Patient Benefit Program, which is very specifically designed for early stage investigators to have small grants to deliver immediate patient care and improvements, and to evaluate those as well. A lot of people finishing a doctorate will go straight into those, but you don't have to be in that position to apply for one. And they never get enough applications either. They always have more money to give away than they have quality applications to submit. Out of turn for saying that live. Is there any more points you'd like to? I'm conscious of time, and we're at 45 minutes now. Zoe, is there any other points that you highlighted the Royal College of Psychiatrists as being a good place to go? Is there any?
Yeah, I think the only point I suppose I'd want to make is that certainly earlier in my career, I think when we think about academics and we think about research, we think about our picture of a kind of academic person, I think can be quite intimidating to more junior healthcare professionals and trainees. And we might feel that that's an unattainable goal, and that might, I think, put people off wanting to be involved in research. And I suppose the point I want to make is that you can be a research active clinician, you can be really involved in dementia research without ever wanting or going down the route of doing a PhD and trying to become a professor of whatever. Recruiting patients to the study, that's really, really important. We can't do any of these studies if we don't have patients. So as a clinician, that's a really important part of your role, and that is you being involved in research actually as a very first step. And then as I say, lots of people work as a sub-investigator on a clinical trial or in a local research centre without necessarily having much background in research themselves. And it's you can try it out, and if you feel so inspired to then take it further into further study or PhDs and things, that's fantastic. But you don't have to, and you can still have a career and a role in dementia research. So I think it's just to make that point that the options are very broad.
Absolutely. And swapping my hats just for a moment, of course, one of the things I'm very pleased to have created in my time at the NIHR is Join Dementia Research was one of my my creations and our office's wider work, and that still exists now. It's a significant way that the NHS finds participants, and of course it always struggles to find sufficient people with dementia, and telling patients about joint dementia research and having that conversation with patients about research to then put them into the register so they can go on to participate in different trials, not just at your trust, but in the wider area as well, is really important and something we've spent a lot of time. So even if all you did right now, this afternoon or tomorrow, one thing you could do straight away is to sign up to join dementia research yourself, because increasingly trials are looking for younger people as well, not just older people, and start to tell your patients about that straight away. And that would have an immediate impact, because Zoe and Leo will use that to find participants, and that's something that literally any NHS member of staff can do.
And I think the benefits to patients of taking part in a research study are huge, actually. And that doesn't necessarily mean because they might have a drug that might help their cognitive function. I think the support and care and regular, visits, and just the sense that you might be trying to do something good out of having this diagnosis, I think is really, really valued by so many people. And I think it's important that we give people the opportunity to do that. And they can say no, but if you don't tell them about it, then they've never heard about it and they don't have the opportunity. So that's
very much. And so there was a question earlier, which I can't see now, maybe perhaps it got deleted, that was that the kinds of studies we're talking about here are, of course, for carers as well. Somebody asked that question. Yes, many of the studies will look at carers to try and ensure that they are providing the best care for their loved ones and the impact on them themselves of supporting somebody with dementia as well. But you have commercial drug trials. There's lots of trials looking at repurposing existing drugs. There'll be interventions to look at how we can diagnose earlier or prevent dementia. There's a whole range of research going on, and it's not just all drug trials. I think is very important to make. There was a question on YouTube asking about NIHR clinical trials units. The NIHR does have clinical trials units up and down the country. I know certainly there is one at UCL. I think there's one in Oxford as well. And if you have a look on their website, they do advertise all of their jobs through the NIHR website as well. If you are thinking about wanting to do a research assistant or go specifically work in a clinical trials unit, they're all associated with NHS trusts. And there are some research centres of recruitment centres of excellence, I believe, as well as the NHR's new. I think Blackpool Hospitals is one of them. I think there's one in Newcastle as well, and I want to say Portsmouth also. I might be Plymouth. I always get confused between those two places. These are new centres which are trying to recruit differently as well, and increasingly working with the communities, because we haven't talked a lot today about community and GP surgeries, but GPs play a really important role in recruiting to these studies as well and doing community work. So that's, if you're working in a GP surgery, you can, again, same places, I think you'd still go to your research network who have primary care as well, don't they? Zoe?
Sorry, I couldn't quite hear you there.
No, I was to say that the local clinical research networks cover primary care as well. So if you're working in a GP surgery, the dementia lead there will know what's going on in primary care also.
Yeah.
And this extends as well to COVID trials, which increasingly we know that people with dementia have been disproportionately affected by COVID. And so there are a number of COVID dementia related trials to become involved in as well, particularly in social care.
Absolutely.
I think we've exhausted all our questions for now, and we are out of time. Thank you, Zoe, Dr. Zoe Clough and Dr. Leo Chouliaras. Thank you very much, both of you, for joining us today. I know Zoe's not on social media, but I know Leo is, so you can find details of Leo's Twitter account in the feed below, which we'll update later this afternoon. So if you have any questions, I'm sure Leo would let you take those as well. And please do, if you have anything, you can post those in the comments on the YouTube, and we'll make sure that they're passed along to both Zoe and Leo. Thank you very much.
Survey.
Oh, there's a survey. So yeah,
I put it in the chat.
Tell us about the survey, just briefly.
Oh, briefly. So as part of our role, we've done a very, very brief survey. It will take less than a minute to complete for anyone who's at an early stage of their sort of career, thinking about wanting to be involved in dementia research, just to help us understand how important people think it is and what some of the barriers might be that we might be able to try and influence how that could be improved. So 1 minute of your time, please, and the link's in the chat.
So link in chat if you're going to do that straight away, and we'll also post it with YouTube. If you could send that to me, Zoe, I'll make sure that's included. So thank you very much again for any further information. The Dementia Researcher website and the NIHR website are great places to start for how to become involved. We have lots of contributors that are at exactly the same stage you are, and our careers page, dementiaresearcher.nhr.ac.uk/careers, has lots of information about the courses and different ways to become involved other than being an academic yourself. Our next webinar is during Dementia Action Week, which will be on the Friday, the 21st of May from 1:30. Dr. Emily Oliver will host that as we hear from a number of researchers who are going to be discussing their work to improve dementia care in acute hospital settings. This will include things like addressing meal times, exercise problems, all kinds of issues around admission. So please do register for that webinar. Details, Dementia Researcher /webinars. Finally, if you'd like to join us and present your own research or come and talk about careers topics or something that's important and passionate for you, please do let us know. We run a webinar once a month. And again, you can direct messages on Twitter, which is @dem_researcher, or send us an email to dementiaresearcher@nihr.ac.uk. Thank you very much again, everybody, for joining us, and we'll look forward to seeing you in a few weeks' time.